Here at Regenesis Health, we look at healthcare differently. And that's why I'm so excited to introduce to you the regenerative medicine component that includes stem cells and other modalities here at Regenesis Health. Stem cell therapy has changed my life, and I've seen it change the life of my patients. And that's why I'm so passionate about making stem cell therapy available, and I want to teach you more about it. Here at Regenesis Health, I customize every treatment plan, and the goal is to make it affordable to every kind of patient that comes across us. Most of all, I want to give the patients options when it comes to regenerative therapies. So I customize it and I offer them anything from stem cells given by injections to the joints, but also IV therapies. But also we have other modalities like exosomes, peptides, intravenous supportive nutrients. So I design for every patient in particular what will be the best care for them. So I do have different options for them when it comes to their care and how it's customized. So regenerative therapies can actually be a savings healthcare for the patients if they see it as something that will prevent them from developing other diseases that can actually cost more in the long run. So yes, regenerative medicine is very proactive. So we will see the patients' longevity and their years to come from now, so they can actually save money in the long run by avoiding these chronic illnesses and diseases that come with aging. So that's something that I believe every patient deserves to have. I like to help people find the solutions that are right for them. So every patient is unique. Every patient has their own goals of treatment, and all I do is to help them find out what those goals are and then give them the options and the tools they need to reach their goals. And if they have no clear goals, if they just know that they want to feel better, then together we can have an idea, a better idea of, okay, this might be my goal, short term, medium term, long term, and then we can figure out a plan with the diverse tools that we have to help them accomplish those goals. So yes, every patient is unique, so I do very individualized care. I don't have a script for everyone the same, but everyone deserves healthcare autonomy. So I am very strong advocate to patients' autonomy when it comes to healthcare. So all I do is kind of guide them and go with them through this journey about their own personal healthcare goals. So when the patient is a candidate for stem cell therapy, it's very, very important that we find high quality products, high quality stem cells. Why? Because the stem cell quality will impact directly on the patient's outcome. In other words, if I can find products that are not as expensive, but they're not going to be the best for my patient, then I cannot definitely offer those treatments for my patient. My ultimate goal is to help my patient accomplish their goals of healthcare. So giving a high quality product ensures me and my patient that these goals will be actually achievable and not just something that maybe will work, maybe it won't work. So yes, high quality products tend to be more expensive, but I know that these products are trustworthy. I know where they're coming from, and I know that they're not going to have side effects or bad reactions to my patients, but actually are going to enhance and promote the healing that we want to see from the inside out to help their own bodies recover their health. At Regenesis Health, we use high quality, third-party tested umbilical cord mesenchymal stem cells and exosomes. The importance of this is that we know what product we're giving to our patients. In other parts of the world, they use stem cells that are cultured in a lab and they are expanded in a lab. That means the quality of the product will decrease as the cells are being multiplied outside of their natural environment, which is the direct birth tissues like placentas, umbilical cords. So they are manipulated, and that is considered a risk for the patient, as it might have deficient cells that are not actually the original ones. They will lack the power to regenerate, in many instances. And that's why in other parts of the world, specifically outside of the United States, it's very common that patients require high numbers of millions of stem cells because the cells have been manipulated. But here at Regenesis Health, we don't use any of those products. We stick to the products that are original from the umbilical cord, birth tissues, and are third-party tested at high levels. So that's the quality of stem cells you will receive, not expanded, not multiplied, not touched by any men or labs. So they're pure cells that will have all the potential to deliver the regenerative power that they carry. Stem cell therapy is not covered by healthcare insurances. That does not mean that it should not be considered as a great investment in your health. So when I talk to you, when I talk to my patients, my potential patients, I want you to understand that investing in your health is one of the greatest things you can do for you, for your loved ones, and for your generations to come. And if you're considering stem cell therapy, I know that you already consider this as a good investment for your health. So yes, there's a high cost to them. It's a great investment, but it is totally worth it. Investing in your health. And yes, insurances will not cover it, but there are ways, and that's why here at Regenesis Health, I want to make this treatment available and affordable to any person that wants regenerative care medicine. Many people want the cost or the price of stem cells just an over-the-phone deal, but in the case of regenerative medicine with stem cells or other modalities, they are highly individualized. So we have to look at different scenarios, different conditions, to be able to determine what the cost of this treatment would be. That's why it's so important that a consultation is made before we can release the actual cost of the products or the services this patient is going to require. Some of the factors can be and are whether the treatment will be with stem cells, with exosomes, so which product we are using, but also which route we are administering these products, because it will be different if I'm injecting a joint, small joint, large joint, multiple joints, or if I'm doing an IV therapy. It's also gonna be different depending on the age of the patient. That's a very important factor. Depending on the weight of the patient, and also depending on the outcomes that patient wants to receive and the conditions that I'm treating. So yes, every treatment will be totally individualized, and then so the cost will depend on the type of treatment, the route of treatment, and the conditions of the patient and their desired outcomes, of course. I totally understand how frustrating it can be when you are trying to look for ways to improve your health and discover that actually the treatments do exist, but they seem so out of reach financially. That's why I have this mission, and it has become my passion to make all of these treatments affordable for every patient. The way I like to work with my patients is I tell them, you're going on a journey of health, and I'm going with you. So I take them from the beginning of their journey, when I see them frustrated, when I see them, they've tried all these things that traditional medicine offers, and how instead of getting better, they're actually getting worse. So I take them by the hand and I said, let's try something you've never tried before. Let's try regenerative medicine, and then I offer them their options. You can start here, and we can go from here to here. So I kind of like show them like a map per se, and I show them, you know, the X marks the spot. This is where we want to get. This is where you want to go. And then I say, this is the routes we can take. And then I leave them to actually choose their route, because I'm not the one dictating how to get there. I tell them, wherever you choose, these are your options. This is what I can offer you at my clinic. And then you tell me which is the route, which is the path you want to take, and I go with you. And that's the way I like to go with my patients. And I've seen tremendous changes And I've seen grateful people that say, you know what, doctor, I didn't think I was going to make it, but I made it. I made it to the X. I am now where I want to be, and I want to continue this journey. So I go with them. I go with them unless they tell me they don't want to keep going. But I have not seen one that says, I want to stop halfway. They all have that perseverance. They all have that desire. And if they have it, I have it, and I go with them. If you have been researching for stem cell therapy cost, stem cell injections, exosome therapy, or regenerative medicine options, I encourage you, schedule a consultation. See the link below so you can schedule yours.